Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome David Fischel. He's a healthcare executive, and today's KevinMD article is How Robotics Are Reshaping the Future of Vascular Procedures. David, welcome to the show.
Hi, thanks a lot for having me.
Well, thank you so much for joining me. I know you're at a conference, but let's briefly share your story and journey for those who didn't read your article or know you.
Sure. So I'm a CEO of a company called Stereotaxis. We're leading the charge in terms of advancing robotics in field of endovascular surgery, mainly cardiovascular procedures, minimally invasive cardiovascular procedures. Prior to that, I came to this through the finance and investing world, where I have invested in medical device companies for a couple decades by now. And so that's me in very brief.
All right. So let's talk about your article. So specifically that intersection between robotics and vascular procedures. I know robots are certainly being used in urological and gynecologic procedures, but tell me how it's being used in vascular procedures.
Sure. So if you think about procedural medicine as a whole, you can categorize surgeries kind of into three rough, very big buckets. Open surgeries, where you have an open incision, the physician holding tools over the patient. Laparoscopic surgery, we're using 3, 4, 5 little holes with kind of functional sticks through those holes. And then endovascular. An endovascular within the blood vessels. You're using the blood vessels of the body as a form of kind of a superhighway to get wherever you want to perform the procedure. And that's obviously kind of from the transition from more invasive to less invasive. You've had kind of open to laparoscopic to endovascular has played out in many fields of medicine. When you talked about kind of urology or gynecology for robotics, that really touches upon the Da Vinci system, which is the most impactful robot that has, by now it's treating a couple million patients a year. And there's 10,000 plus Da Vinci systems out there in the world. That has really transformed laparoscopic surgery. So from urology to gynecology to thoracic surgery to abdominal surgery, and robotics in laparoscopic surgery is a major force. Similarly, in the open surgical space, you have robots for orthopedic surgeries, knees, hips, spine, and so that has also kind of played out. It played out probably a decade after laparoscopic robotics, but it's played out in a major way. In the endovascular field, there's essentially no robots, and that's what Stereotaxis is really focused on. In a typical endovascular surgery, you are inserting catheters, small, 1 millimeter, 2 millimeter in diameter catheters through the blood vessels. You usually access the blood vessels through the leg or the arm, and then you'll navigate the catheter to the heart or to the brain or to the periphery or to wherever else you need to deliver therapy. The challenge with robotics in the endovascular field is that what you typically think about when you think about industrial robots doesn't work when you're working with, you need flexibility to navigate the tortuosity of the vasculature, and you need to work in very small, delicate anatomy. And so the normal ways you think about kind of metal and hard robots doesn't work in that environment. And that's where we kind of came with a very different approach to advance robotics in that field.
So tell us the type of vascular procedures that your technology best addresses.
So let's say today I'm at a conference by the Heart Rhythm Society, and it's really focused on the treatment of patients that have heart arrhythmias. So when the heart doesn't beat regularly, and that can lead to kind of to issues, obviously. And so there's a fairly common procedure. There's probably about 1.7 million procedures like this done a year, where you navigate a catheter into the heart, and then you actually burn some of the misbehaving heart muscle cells, and by doing so, you get the heart to beat in a normal rhythm again. It's called cardiac ablation procedures, and so that's our most common procedure performed with our system. By navigating the catheter robotically, you allow for a level of precision and stability and safety that is otherwise impossible to have with a typical handheld catheter. And so that's really kind of where we add value. We've treated about 160,000 patients, or physicians have used our technology to treat about 160,000 patients to date in that field. And then there's some other fields where we're starting to try to advance robotics also there. But cardiac ablation to treat heart arrhythmias is really kind of our core market right now.
And tell me the type of outcomes data that you have for people who use your approach.
So it depends. There's obviously a wide range of arrhythmias and there's a wide range of outcomes depending on that and depending on the user. But when you look at the overall data on robotics in the field of cardiac ablation, you see several kind of consistent themes in the clinical data across, it doesn't matter which operator in which types of arrhythmias. The main themes are safety. So because we're navigating a catheter from the tip directly, you don't need a rigid catheter. You can have a very soft, gentle catheter that's being navigated by the robot, and that allows you to have a catheter that's atraumatic in the heart. One of the risks in typical cardiac ablation procedures is that if you move the catheter too quickly or too hard against the tissue, you can puncture the heart. Yeah. That happens in around 1% of cases. And so kind of consistently in every clinical study, you see a significant reduction in major adverse events, in heart punctures and other adverse events. A second big theme is the improvement of enabling physicians to treat complex patients that otherwise wouldn't be good candidates for therapy. So if you think about patients who were born with congenital heart defects, or pediatric patients, or patients where you're trying to treat arrhythmias that are sourced from the lower chambers of the heart, from the ventricles of the heart, where it's more difficult to get there, and those pump harder, so it's also more difficult to stay stable on the tissue. Those are the types of procedures where we do very well. And so there's, let's say, one of the largest studies in the VT space, ventricular tachycardia, which is a type of more complex arrhythmia, was about an 800 or so patient study, and they looked at efficacy, safety, and efficiency of the procedure and showed statistically significant improvements in all three of those robotically versus manually. And so those are kind of the areas we really enable the more complex things and the more dangerous and the more challenging procedures to get done well, so that you can expand minimally invasive therapy to patients that otherwise wouldn't get that therapy.
Now, how about from the perspective of the proceduralist? I'm an internal medicine physician, so I'm actually not that familiar with the ablation procedure. So maybe contrast the two stories. So how is it traditionally done, and contrast that with how it's done robotically from the perspective of the proceduralist. What's it like for them?
So for a physician, if you kind of want to paint an image in your mind, in a typical cath lab, kind of the operating room where all of these procedures get done, you have usually an X-ray kind of right in the center of the room with an operating table right by the X-ray. And that's kind of X-ray is a primary form of visualization during these procedures. And then a physician would stand by the table and they'd insert catheters into the patient's leg, and they'd be standing there manipulating the catheters with their fingers and wrists. And that's kind of how a typical procedure looks like. The challenge for the physician is that they're doing hours worth of procedures a day. Yeah. And they're standing there very close to the X-ray beam, and they're wearing a lead vest to protect themselves from the X-ray. But so they're kind of wearing 20, 30 pounds of lead on them, standing close to the X-ray and being exposed to radiation the entire procedure. And they're having to do micro movements of their hands to try to move a catheter in the body. What we do with the physician is that the physician, when they do a robotic procedure, they unscrub, go to a control room, which is right by the operating room, 2, 3, 4, 5 meters away. They sit behind a computer cockpit, and then they're using a keyboard, mouse to really steer the catheter. So on this large screen display where they get all the diagnostic information on the patient, they can say they want to move the catheter in this area or that area of the heart, and we know how to adjust the magnetic fields around the patient accordingly to steer the catheter as they wish. And so they're doing the entire procedure seated, kind of in full control of things without being exposed to radiation. And kind of, I think the beauty there, and you kind of as a physician, it'll probably resonate very well, is that as a physician in procedural medicine, you have to have two big skills. You have to have the cognitive skill of being able to understand the patient in front of you. Why do they have a disease? What's the issue with them? How do you want to treat them? And then you have to have the hand skills. How do you get the tools at your disposal to actually do what you want them to do? When you put a physician behind the robot, it allows the mechanical aspect of the procedure to be simplified so that they can spend more of their mental focus on the cognitive aspect. And that's kind of a big, as a patient, if me or you are lying on the table, you want your physician to not be stressed, to not be tired, kind of to be able to be fully focused on the cognitive aspect of the procedure.
And what kind of training does a physician need to become proficient in your system?
So physicians in, let's say, the cardiac ablation field go through a huge amount of training. They become, right, they do internal medicine like you did, they do interventional cardiology, and then they do a subspecialization in electrophysiology, which is kind of the electrical signals of the heart. We actually offer robotic electrophysiology fellowship program at a couple dozen or so hospitals, where fellows who are going through their typical electrophysiology training also get trained on robotics through simulators, through procedures, and then when they graduate with expertise also in robotics. And it's robotics is more intuitive than hand motions. So the hand motions are very much non-intuitive. Now you learn it like learning how to play a piano. Robotics is much more intuitive, but there is also a learning curve there, and we have simulators and obviously procedural training that allows fellows to get proficient.
Any other conditions other than ablations that you can see your technology being applied to now or in the future?
Definitely. One of the big challenges in the broader field of endovascular surgery is navigating tortuous, twisty, winding vasculature and getting where you need to deliver therapy. So if you think if a patient has a stroke, oftentimes to get to the point in the brain where the stroke has taken place to be able to pull out the clot or aspirate the clot out is very difficult. And if you're trying to deliver embolization agents for a liver tumor, delivering that can be difficult. To get to the right blood vessels that are feeding the tumor, to occlude those can be very difficult. In some of the coronary cases, if you have total occlusions of coronary vessels, to get through them can be very difficult. And when we steer our interventional devices directly from the tip, rather than applying forces 2, 3, 4 feet away at the handle and hoping that you can steer the tip through the translation of the control over that entire length of the flexible device, it allows you to steer things in a way that is otherwise impossible. The magnets of our robot are like these invisible fingers allowing you to hold onto the tip of the catheter. That's what gives it the precision and the stability. And so we've developed a family of guide catheters, guide wires that help physicians steer through that tortuosity. And I hope over the coming year, we're going to start to show the value of the robot in procedures like stroke and tumor, liver tumors and complex coronary, complex peripheral cases.
And how readily available is this technology?
So we're still a young company and relatively in the early stages of our commercialization. We've been working predominantly on a lot of engineering efforts and clinical regulatory efforts over the last 5, 6 years. We have about 100 hospitals around the world that are using our robot. As I mentioned before, I've treated over 150,000 patients with the robot. But a big effort of us has also been, how do you make the robot, the original robot, the robot that's being used still predominantly around the world, requires a hospital to do a decent amount of construction in order to actually accommodate the robot and build a lab that can accommodate the robot. We got CE mark in Europe for a newer robot. Recently, we submitted also in the US for FDA approval for that robot. And that kind of will make robotics much more accessible, so a hospital doesn't have to do construction in order to build a robotic cath lab. And so that's a big other goal of ours. You can have the coolest and most beneficial technology in the world, but if it's not readily accessible, then obviously its impact is muted. And so at the end of the day, we're a medical device company. Our goal is that there's unmet medical need. Patients still suffer out there. There's room to improve medicine. You want to make your technology broadly accessible so it can have the biggest impact as possible.
We're talking to David Fischel. He's a healthcare executive, and today's KevinMD article is How Robotics Are Reshaping the Future of Vascular Procedures. David, let's end with some take-home messages that you want to leave with the KevinMD audience.
I'm delighted to be on the show. I think working in medical devices and the innovation of devices and thinking about unmet medical needs and how to pioneer new areas of medicine is probably the most fascinating journey one could go on. So anyone who's interested to go on that journey, I encourage you to go through it. It is a winding, tough path, but it is an awesome one.
David, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you very much.